This is the story of Maggie's heart. Maggie is a lively 5-year-old boxer who enjoys hiking, taking long walks, and spending time with her family. Recently, Maggie's owner noticed that she doesn't have the energy she once had and is no longer interested in the activities she used to enjoy. One day, after returning home from their daily morning walk, Maggie began stumbling and soon after fell to the ground, unconscious. Thankfully, Maggie's owner was nearby and was able to remain with her until she awakened about a minute later. Full of concern, her owner immediately rushed her to the vet's office, where she presented with an abnormally rapid heart rate, a weak femoral pulse, and continued weakness. After performing an electrocardiogram and other tests, she was diagnosed with ventricular tachycardia, a rapid heartbeat originating in the ventricles, a possible result of arrhythmogenic right ventricular cardiomyopathy, a common heart condition for boxers. Maggie's fainting was a result of a very fast ventricular tachycardia episode with a heart rate over 300 beats per minute. Thankfully, the episode ended quickly and returned her heart to normal sinus rhythm. In order to treat Maggie's ventricular tachycardia, a number of antiarrhythmic drugs can be used. Sotalol is most commonly used with boxers as it acts to return the heart to normal sinus rhythm and helps to prevent additional arrhythmias. It can reduce or even stop fainting and can decrease the risk of sudden death, a common result of ventricular tachycardia. A compounded version with mexaltine is usually administered when maximum doses of sotalol are not effective. When used in boxers, the initial dose of sotalol must be low and then slowly titrated upward. Maggie's owner should be aware of potential side effects of hypotension and vomiting. Mexaltine depresses myocardial excitability, but has been found to be less effective in preventing sudden death when given alone. If Maggie is resistant to these drugs, amiodarone can also be used. However, it is not used as frequently because it is slow-acting and has more serious side effects, including anaphylaxis, increased liver enzymes, and thyroid conditions. If Maggie were to have a sudden onset of ventricular tachycardia, IV drugs can also be used. Lidocaine is given IV in order to return the heart to normal sinus rhythm. If it is not effective, procainamide, a local anesthetic, can also be used to produce the same effect. After the initial bolus infusion, a constant rate infusion of the effective drug should be administered. If using procainamide, Maggie may experience side effects of vomiting, diarrhea, and weakness. More diagnostics are needed in Maggie's case to determine the extent of her heart condition. However, the vet prescribes sotalol and mexaltine to begin treating the ventricular tachycardia. With continued treatment, Maggie is bound to live a happy, healthy life.